In yesterday's class, I told you the examples of anti-epileptic drugs. Try to remember. This is chemical classification. I have taken this classification from Shanbhag testable. This is chemical classification. In this, we have first class of anti-epileptic drugs are hydantoins, hydantoin analogs or hydantoins. In that, we have phenytoin and fosphenytoin, and we have barbiturates, phenobarbital, phenobarbitone, phentobarbitone. These all barbiturates we have already discussed in previous classes. If you want to learn about these barbiturates, you can see the description. I'll provide the link in the description. You can watch this barbiturates video. And we have immunostilbins. Here we have carbamazepine, important drug, carbamazepine, oxcarbamazepine. And we have carboxylic acid derivatives. Here we have sodium valproate, very important drug, and divalproex. And we have succinamide. In that we have ethosuximide bolte, okay. So diazepines, lorazepam, diazepam, clonazepam, all zepams, these are benzodiazepines, okay. I mean benzodiazepines, these are examples. In this, lorazepam is very important. Lorazepam, sometimes it is suggested in emergency conditions because of its rapid onset of action. And in others means these are newer drugs. These drugs, they are not having specific chemical classification, so they are considered as other anti-epileptic drugs. In that we have lamotrigine, topiramate, gabapentin, pregabalin. Gabapentin and pregabalin, these are considered as GABA analogs. You can categorize them as GABA analogs. GABA analogs, okay. And we have tiagabine, vigabatrin, zonisamide, levetiracetam, and lacosamide. So these are the different examples of drugs which are commonly used in epilepsy. They are used in seizure disorder. Just try to remember all these names. See, in yesterday's class, I was explaining you the normal physiology of seizure. Okay, physiology of seizure. Just imagine this is a presynaptic nerve and this is a postsynaptic nerve. Yesterday already we have discussed all these concepts. See, whenever presynaptic nerve is stimulated, when presynaptic nerve or whenever brain is affected, just imagine this is a brain. Whenever brain is affected, in brain we have focal type of seizures and generalized seizures. Okay, partial seizure bolte. If one part of the lobe of one single lobe is affected, that is called partial seizure. If both the lobes are affected, that is generalized seizure. So either in partial seizure or generalized seizure, what happens? The action potentials will generate. These action potentials will travel to the nerves. When action potentials are rapidly produced, these nerve, the presynaptic nerve or the nerve which is originating from the brain, these will be stimulated. Okay, these will be stimulated. In this nerve is stimulated especially by opening the sodium channels. These sodium channels, when action potentials are generated, what happens? The sodium channels will be opened. These sodium channels are called voltage gated or voltage gated ion sodium ion channel, voltage gated sodium channel, okay. This voltage gated sodium channel will be opened and through this sodium will enter inside. When sodium enters inside, what will happen? Depolarization occurs. Again, the calcium channels will be activated, which are called high voltage gated calcium channels. Calcium enters and the glutamate or excitatory neurotransmitters, whatever are there, they will be released and they'll fall on AMPA and NMDA receptors, and further it will produce or it will stimulate the postsynaptic nerve and it will propagate the convulsion. It will propagate the seizure. It will propagate to other organs and it will cause convulsion. So this is the general physiology. In yesterday's class we have already discussed. See, initially the seizure is starting from voltage gated sodium channels, okay. Voltage gated sodium ion channel is initially it is stimulated, it is opening, sodium is entering inside, and from here the actual propagation of seizure is starting. So to stop these sodium channels, we have certain drugs. In yesterday's class I explained you there are some drugs which will inhibit the sodium channels. In that, examples are sodium valproate, topiramate, carbamazepine, oxcarbamazepine. We have so many examples. Just see here. Just try to remember these. All these drugs: phenytoin, fosphenytoin, carbamazepine, oxcarbamazepine, sodium valproate, lamotrigine, topiramate, zonisamide, lacosamide. All these drugs, these are anti-epileptic. All these drugs, what they will do? They will inhibit the sodium channel. They will inhibit the voltage gated sodium ion channel on the presynaptic nerve or on the nerve which is originating from the brain. Actually, you see, we have three types of sodium actions. Okay, actually the sodium channel, just imagine this is cell membrane, the nerve cell membrane. This nerve cell membrane will be experiencing three types of actions. Actually this membrane is having sodium channel, just imagine this is a sodium channel. Okay, this sodium channel is the voltage gated sodium channel, right? When this sodium channel opens, what will happen? Sodium will enter inside the cell. Sodium will enter inside the cell from the extracellular space or extracellular fluid. It will enter into the intracellular space. See, this voltage gated sodium channel will be experiencing three phases. In that we have three phases. Number one, first phase of activation of sodium channel is resting membrane potential. Second phase is it will be activated. It will be activated. And third phase is it is inactivated. Okay, see, this sodium channel will be experiencing three phases. In that first phase is it will be in resting membrane potential. In resting position, sodium will neither go in nor sodium will come out. It will be in resting membrane potential. And second phase is it will be activated. When sodium channel is activated, what happens? It will be opened and the sodium will immediately rush into the cell. Okay, that is activated phase. And in third phase, immediately the sodium channel will be inactivated. In inactive phase, what happens? This channel will be closed. This channel will be closed and sodium will not enter inside the cell. So these are three phases. So all these drugs, what they do, all these drugs will prolong the inactive state. Simple. See, they are not closing the channel close nahi kar rahe. What they are doing, all these drugs are prolonging the inactive state. Agar inactive state prolong ho gaya, to what happens? The sodium channel will be closed for prolonged period of time. So due to that, it is inhibiting the entry of sodium channel. You should not confuse when you read the textbooks. You should not confuse. Simple. All these drugs are, they are prolonging the third stage of inactivation of sodium channel. Okay, and through that sodium ions will not enter inside. When sodium is not entering inside, what happens? Action potentials will stop here, and further it will prevent the propagation of action potentials, and through that it will stop the convulsion in the patient, or it will stop the seizures further. I think you all understood this basic mechanism of all these drugs. Okay, see, just try to see the image. This voltage gated sodium ion channel is having three phases. First phase is resting state, second is inactive state, and third is inactivated state. Here in resting position, what happens? Actually it is active stage. It is active state. Active. Maybe it was playing. What happened? Suddenly it stopped. Wait, let me check. Now you see, it is playing. Immediately active state ke baad, immediately it will be inactivated. So when sodium enters, that is called active state. When sodium stops coming inside, that is called inactive state. And this inactive state will stay for some period of time. And when we go with these drugs, all these drugs, what they do? They will prolong the inactive state. This state will be prolonged. Due to that, they will reduce or they will stop the entry of sodium inside the cell. I think you all understood this mechanism of phenytoin, especially not phenytoin, all these drugs. The mechanism is common for all these drugs. See, most of the drugs are stabilizing the nerve membrane by stopping the entry of sodium ions inside the cell. I will not prolong from here. Anyways, I think you all understood this mechanism, because this mechanism is common for most of the drugs. That's why I'm repeating. Okay, now you see. Now let me tell you about each drug. I will try to explain about phenytoin. Phenytoin is very, very important drug. Very, very important drug. Why it is important? Because in most of the seizure disorders, phenytoin is the drug of choice. In most of the disorders, phenytoin is the drug of choice. It is drug of choice in tonic clonic seizures, in most of the generalized seizures. In all generalized seizures, tonic seizures, clonic seizures, tonic clonic seizures, in myoclonic seizures, it is drug of choice. Phenytoin is also drug of choice in focal seizures. Okay, in focal seizures, in last class we discussed. In focal seizures, we have consciousness or unconsciousness. Actually, in focal seizures, unconsciousness is not seen, but in generalized seizures, patient will have unconsciousness mostly. In focal seizures में भी हो सकता है. Okay, and one thing you should remember, phenytoin is not phenytoin is not given in absence seizures. Okay, phenytoin is not given, it is not the drug of choice in absence seizure. Other than absence seizure, phenytoin is drug of choice in most of the seizure conditions, especially if patient has convulsions. Other than absence, phenytoin is the drug of choice in most of the seizure conditions. Okay, this is the important point you have to remember. Now see, let us go in detail about this phenytoin. First, see, this is the normal structure of phenytoin. One thing you have to remember, let us see some basic chemistry of phenytoin, because this is very very important. That's why I'm explaining. What is this chemical structure called? It is called imidazole. Okay, on the first position we have one nitrogen group, and on the third position we have second nitrogen group, and this compound, this molecule with two double bonds, here we have two double bonds, this molecule is called imidazole. Okay, this is the basic molecule. When imidazole is reduced, when this imidazole is hydrated, when imidazole is undergone with reduction reaction, these two double bonds will be removed and hydrogen will be added, and it forms, upon reduction, it forms imidazolidine. Initially it was the basic compound imidazole. Imidazole was reduced, two double bonds were removed and two hydrogens were added. One hydrogen will be added somewhere here or here, fourth or fifth, and one hydrogen will be added on the third position on this nitrogen. So it forms imidazolidine. Imidazole was reduced to imidazolidine. Okay, you see the chemical reaction. Imidazole is it is reduced to imidazolidine. Okay, actually here one hydrogen is added somewhere here, and second hydrogen is added on the nitrogen group. Okay, now you see this imidazolidine is again added with carbonyl group bolte, carbonyl group. What is carbonyl group? This imidazolidine is again added with carbonyl group, and it will form hydantoin. This is called hydantoin. Are you all following me? See, actually this carbonyl group is added on the second carbon chain and on the fourth carbon chain, and it forms hydantoin. See, phenytoin was hydantoin compound. In chemical classification we have seen. Now what is hydantoin? Hydantoin was the basic compound which is obtained from imidazole. Imidazole was reduced to imidazolidine. Imidazolidine is added with two carbonyl groups, and it is forming hydantoin. Now you see this hydantoin basic molecule. This is the hydantoin basic molecule, and from this hydantoin we can synthesize phenytoin. So this is the structure of phenytoin. Actually, in this hydantoin, what happens? Two phenyl groups will be added in this hydantoin group. That's why phenytoin is also named as diphenyl hydantoin. Why phenytoin is named as diphenyl hydantoin? Because hydantoin molecule के अंदर दो phenyl groups है, दो phenyl functional groups are added. That's why it is named as diphenyl hydantoin. These are some basic points about phenytoin. See, why I am explaining all these things in adverse effects, you will understand. Okay, so these are some basic points, and I'll not go further about synthesis and all. I'm not biochemistry teacher or medicinal chemistry ये सब expert नहीं है, but I'm just trying to make you understand some basic things. Now you see, just now what I told you, I was explaining about phenytoin, right? Phenytoin is the molecule which is the imidazolidine molecule. It is the hydantoin molecule. First important point about phenytoin, यहाँ से ध्यान से सुना सब लोग. Everybody should listen very carefully about phenytoin, because phenytoin is very very commonly used in hospitals. First thing, it is the drug of choice in most of the seizures. Just now I explained. Most seizure conditions में, most convulsions में, phenytoin is drug of choice. And one more point I told, it is not choice in absence seizures. It is not the choice in absence seizures. This is second important point. थर्ड इंपॉर्टेंट पॉइंट याद रख लो सब लोग. In yesterday's class I was explaining you most of the anti-epileptic drugs will cause sedation. Yes or no? This point I explained in yesterday's class. Most of the anti-epileptic drugs will cause sedation, but phenytoin has very limited sedation action. This is the one of the brilliant extraordinary points by which we commonly suggest phenytoin in most of the conditions. Sedation activity is very less when compared with other anti-epileptic drugs. That's why phenytoin is most commonly given in hospitals. This is one useful point. Sedation is very low. It is having very low drowsiness. Drowsiness कम है बोलते. Okay, this is the three important points you should never forget about phenytoin. Now let us discuss about the pharmacokinetics of phenytoin. Phenytoin के pharmacokinetics जिंदगी में कभी भूलना नहीं. First, absorption. Phenytoin के absorption कैसा है? Phenytoin will slowly it is absorbed from GI tract when it is given through oral route. When phenytoin is given through oral route, slowly absorption is seen. Rapid absorption is not seen with phenytoin. Phenytoin is slowly absorbed. Okay. Number two, phenytoin is available in IV form also. So when it is given through IV form, bioavailability is 100%. And immediately when drug is distributed in the body, 90% of phenytoin, this is important point, 90% of phenytoin is bound to the plasma proteins. 90% is bound to the plasma proteins and 10% is freely available in the blood. We are discussing about the pharmacokinetics in absorption. Most of the phenytoin is absorbed from GI tract, but absorption is slow. Absorption is again slowed down when it is taken along with food. Food के साथ लिया तो absorption और delay हो जाएगा. Okay, already it is absorption is slow. When it is taken with food, again it will be slowed down. But most of the studies what they are telling, it can be taken before food or after food or along with food. Anyways, it is absorbing slowly, so there is no major changes in absorption when it is taken along with food or other food substances. So absorption, it is slowly absorbed. In IV it is available, and in distribution 90% it is having protein binding capacity and 10% is available freely. And now next, metabolism. See, most of the phenytoin is metabolized in liver. Okay, in liver it is metabolized and the metabolic end products are excreted in urine, through urine. And here in the liver you should remember, if phenytoin is given in continuous more than 2 to 3 doses, phenytoin will cause enzyme induction. It will induce enzyme. In previous classes I explained you enzyme inducers. In enzyme inducers what we have? crab GPS, C carbamazepine, R rifampicin, A alcohol, P phenytoin, G cresofulvin, P phenobarbital, and S is sulfonylureas. Okay, these are the examples of drugs which will cause enzyme induction in the liver. The cytochrome P450 enzymes which are responsible for the metabolism of drugs are induced. All these drugs what they do, they will induce. Along with all these drugs, phenytoin also induces liver enzymes. Now you see, along with phenytoin, if other drugs are given, the concomitant drugs which are taken along with phenytoin will be metabolized rapidly. It will metabolize rapidly. That's why what happens when phenytoin is given, it may cause enzyme induction, and the activity of concomitant administered drugs concentration will be decreased. For example, here warfarin is there. If warfarin is given along with phenytoin, warfarin action decreases. Oral contraceptives are given, oral contraceptive action decreases. यहाँ पे thrombosis बढ़ जाएगा, contraception fail हो जाएगा. Okay, so this is the important point you have to remember. Not only warfarin and oral contraceptive, there are so many other drugs whose levels should be monitored properly. Narrotherapeutic drugs जो भी है, when they are given along with phenytoin, we have to take care. And one more important point, remember, as it is an enzyme inducer, it can induce enzymes and it will induce metabolism of itself. Self metabolism खुद से बढ़ा लेगा. Concomitant administration of phenytoin and other drugs, other activity decreases, and phenytoin itself will be metabolized because it is inducing its own cytochrome P450 enzymes. This is one more point you have to remember. And see, at last I would like to explain about excretion. In excretion you all should concentrate. Absorption is done, distribution is done, metabolism is done. in liver induction property we have seen. Now after metabolism, total drug is excreted through urine, right? So in urine what happens? See, excretion of phenytoin. Excretion of phenytoin. See, excretion, during excretion, phenytoin will follow two types of kinetics. See, in low doses, phenytoin will follow first order kinetics. How many of you know about first order kinetics? How many of you know about first order kinetics? First order kinetics, zero order kinetics. सुने नहीं सुने? See, listen. Everybody should listen. See, especially I'm talking about phenytoin. Phenytoin in low doses. In low doses, excretion is very high. Low doses में excretion फटाफट हो जाता. Because in low doses, phenytoin is following first order kinetics. First order kinetics is the kinetics where the chemical reaction or the half-life depends especially on the concentration of the reactant or the drug. First order kinetics is the kinetics where the removal of the drug or metabolism of the drug follows. It is mainly depend on the concentration of the reactant. If concentration is low, this excretion is high, because it is maintaining first order kinetics. And see, when phenytoin concentration increases due to high doses, in high doses it will follow zero order kinetics. Zero order kinetics is the reaction where it will not depend on the concentration के ऊपर depend नहीं होगा. यहाँ पे chemical reaction is constant but it is not depend on the concentration. Here it is following first order kinetics. Concentration से excrete हो जाएगा. यहाँ पे concentration ज़्यादा है तो भी it will not be excreted. Why? Because it is following zero order kinetics. In zero order kinetics, it will not depend on concentration. So simple thing, excretion of phenytoin in low concentrations, excretion is high. In high concentration, excretion is low. That's why when phenytoin is given, we have to keep monitoring the dose, keep monitoring the levels of phenytoin in the serum. Agar serum phenytoin concentration slightly increases, what will happen? It will follow zero order kinetics and its half-life is increased and it will not be excreted properly. So what happens in high doses? It will have high probability of causing toxic effects. That's why phenytoin is considered as narrow therapeutic drug. Phenytoin drug concentrations should be maintained properly when it is given in higher doses. Okay, so this is the important point you have to follow, especially in excretion. Okay, so this is about pharmacokinetics of phenytoin. Now see, let us see the uses of phenytoin. Just now I explained you phenytoin is available in IV form, phenytoin is available as tablet form, and phenytoin is also available as capsule form. Okay, 100 mg capsules, 100 mg tablets, 250 mg is available in 5 ml of compound. Okay, see, these are different formulations of phenytoin. Now you see one important point you have to remember here, especially during administration. If anybody has emergency condition, like in epilepsy we have status epilepticus. In status epilepticus, do you go with tablet form or do you go with capsule form or do you go with IV form? Obviously we'll go with the IV form, right? So phenytoin is available in tablet form, capsule form and IV form, and this IV form is given in emergency condition, especially in status epilepticus. And here this IV form of phenytoin should be diluted in normal saline and it should be slowly infused over 30 minutes to 60 minutes. And one important contraindication precaution we have to take, phenytoin should never be mixed with dextrose, because phenytoin will cause precipitation. This is the very important drug interaction with dextrose. Okay, administration interaction bolte isko. When phenytoin is given in IV form, always remember phenytoin should not be given rapidly in IV bolus. It should be diluted in normal saline and that should be slowly infused over 30 to 60 minutes. And it should never be mixed with dextrose because it will cause precipitation. This is the point about IV administration. And when it is given through tablet or capsule, no need to follow any precautions. Anyways, its absorption is slow, so it can be taken either with food or before food or after food. no problem. This is about administration. Now see, let me tell you the uses. Phenytoin is used, just now I explained you, phenytoin is used in all kinds of seizures. It is used in generalized seizures, partial seizures, focal seizures, tonic-clonic seizures, clonic seizures, atonic seizures, myoclonic seizures. All these type of seizures yesterday we have discussed. Okay, it is especially commonly used in generalized tonic-clonic seizures. This is the first use. It is used in all kinds of partial seizures. It is used in status epilepticus because it is available in IV form. It is used in trigeminal neuralgia. Trigeminal neuralgia. There are some neuralgia conditions. Neuralgia. You know what is neuralgia? Neuralgia is the nerve pain conditions, headache, nerve pain. Especially if there is a nerve which will innervate into the facial organs, lower jaw, upper jaw, eyes, cheek. That is called trigeminal nerve. If any damage occurs to this trigeminal nerve or due to inactivation or hyperactivation of this trigeminal nerve, it will cause pain. So in trigeminal neuralgia also phenytoin is used because phenytoin is stabilizing the sodium channels, and through that it will decrease the action potentials and it will decrease pain in neuralgia. Neuralgia pain maybe phenytoin is used. And one important point, phenytoin is especially used in uh, seizure disorder, epilepsy seizure disorder में use करते हैं, trigeminal neuralgia में भी use करते हैं. Okay, these are important uses of phenytoin. Now you see, now let us try to discuss about adverse effects of phenytoin. Very very important point. Adverse effects of phenytoin. See, in adverse effects always remember H. We have 7 to 8 H's. First H is hypertrophy. Hypertrophy of gums. Hypertrophy of gums. See here, you can see the image. Phenytoin is causing uh, hypertrophy of these gums. This is one adverse effect. Chronic use of phenytoin can cause gum hypertrophy, and it will cause hypersensitive reactions. It will cause hirsutism, another H, and it will cause hyperglycemia, another H. This it causes hyperglycemia due to lack of insulin release कम कर देगा, and through that it will cause hyperglycemia. Hirsutism means abnormal growth of hair in females and in males. Wherever hair should not be grown, in those areas also it will be growing hair. That is called abnormal development of or abnormal growth of hair is called hirsutism. See here, hirsutism. In females it will cause growth of hairs, and it will cause megaloblastic anemia due to folate deficiency. Okay, folic acid deficiency is seen with phenytoin. It will cause osteomalacia due to rapid metabolism of vitamin D. Vitamin D metabolism फटाफट ज़्यादा कर देगा. Why? Because it is a enzyme inducer. Okay, it will cause osteomalacia. It will cause hypocalcemia. देखो विटामिन डी कम हो गया तो क्या होगा? विटामिन डी एक्शन इज मेनली absorption of calcium in the GI tract. It will cause hypocalcemia, another H. It will cause fatal Phenytoin syndrome, another H. It is fetal Phenytoin syndrome. You know what is fetal Phenytoin syndrome? If phenytoin is taken in pregnancy, it will cause fetal Phenytoin syndrome. See, abnormal development of limbs, abnormal development of organs, all these things can be seen with phenytoin. So phenytoin is highly teratogenic. याद रख लेना. Okay, because see, it is the molecule of Phenytoin, right? Phenytoin molecules कुछ भी लो आप, Phenytoin molecules are having high teratogenicity. That's why phenytoin will cause teratogenicity. That's why it is never. See, in pregnancy patients will develop eclampsia. In yesterday's class I told eclampsia. Hypertension के वजह से patient will develop eclampsia, and this eclampsia will cause seizures. So in that cases, usually in eclampsia and pre-eclampsia, anti-epileptic drugs are given. Here never prescribe phenytoin. सर पढ़ा रहे थे all kinds of seizure में phenytoin is drug of choice. तो pregnancy नहीं देखा, ऐसा दे दिए तो क्या हुआ? It will cause teratogenicity. Okay, this is another important point about phenytoin. And see, some other adverse effects in higher doses. Phenytoin has some other adverse effects, especially in central nervous system, cardiovascular system, and in GI tract. In central nervous system, it will cause vestibulocerebellar syndrome. Vestibular dysfunction हो जाता. Actually, vestibule is the tissue organ which is present in the inner ear. This will maintain the stability of the body. Okay, so in higher doses of phenytoin, it will disturb the vestibulocerebellar tissue and it will cause vertigo, ataxia, stability नहीं रहता patient, tremors, patient हिलता रहता इधर उधर, patient will fall down, patient will be having blackouts, patient can't stand properly, patient will be having headache, patient will have nystagmus, patient will have psychological disturbances, stability नहीं रहता patient. So these are central nervous system disorders. You have to remember all these adverse effects, okay? And in cardiovascular system, phenytoin will cause hypotension, cardiac arrhythmias. Hypotension हुआ तो arrhythmia हो जाएगा, okay? Especially that occurs in IV administration. And in GI tract, it causes nausea, vomiting, and dyspepsia. So to reduce these adverse effects, what we have to do? We have to advise phenytoin after food. After food. Before food दिए तो क्या होगा? खाना खाएगा, vomiting आ जाएगा patient. No use of taking food. That's why advise these tablets only after food. Okay, this is another adverse effect. Next drug is phosphenytoin. Phosphenytoin is the common it is the drugs having same action like phenytoin, and it is also the compound which is obtained like from phenytoin. Okay, and phosphenytoin के बारे में एक चीज you have to remember, it is the prodrug. phenytoin का prodrug है which will be converted into phenytoin in the liver, and dose is usually given as phenytoin is given. It is available either in IM form and IV form. So in emergency phosphenytoin is the commonly used drug. Why? Because see, one advantage you have to remember, phenytoin has some irritation property. It will cause hypotension when given, it may cause hypersensitive reactions, it may cause it is having many adverse effects. All these adverse effects which are occurring due to IV administration are not seen when phosphenytoin is given. Those adverse effects are not seen with phosphenytoin. This advantage you have to remember about phosphenytoin. Okay, and yes, here phosphenytoin it can be given in normal saline, it also can be given in glucose because it will not cause precipitation. Okay, it is having compatibility with glucose, it can be given, and it has less irritant property than phenytoin. This just now I explained you, and it is preferred in status epilepticus. Phosphenytoin is preferred over phenytoin because it is having less irritant effect and it is commonly used in status epilepticus. Okay, and rate of IV infusion is, it should not be exceeding 150 mg as phenytoin, and sometimes it will cause hypotension, cardiac arrhythmias. Hypotension and cardiac arrhythmias are common like phenytoin. Okay, so these are the important points about phenytoin. phenytoin के बारे में बहुत important है, बाकी के drugs पूरे easy है. We will discuss about other drugs in next class.